Hello, everyone. My name is Olivia, and we've just gotten some new news. The AAMC is now transitioning from the VITA interview to the SJT, or the Situational Judgement Test. So I'm here with Dr. Ed Lipsit, the Associate Director of Advising here at MedSchoolCoach and former Admissions Committee member at the Virginia Commonwealth University. He's going to give us a little overview of the situation and the changes, and then I'll ask him some questions. Dr. Lipsit?
Great to be here. Thank you. And welcome to everyone. Um, the Situational Judgment Test, or the SJT, it's actually been around for a while, but it was never really utilized in the admissions process until recently. Now, you know about the traditional interview format, of course, and also the MMI format, which was developed at McMaster University. Now, with the pandemic, that created a great strain on the interview process. Obviously, online was the method that was to be introduced rather than on campus or in-person interviewing. So, as a response to that, the AAMC came up with their VITA, or Video Interview Tool for Admissions. And that was an online way of interviewing. Now, some schools used the VITA for the interview process. Many of them, though, used it as a screening tool.
Mm.
In other words, a school would extend an invitation to an individual to take the VITA, and then based on that, might progress down the application cycle and get a formal online interview. The um, the video platform for the VITA was one way where uh, areas of competence would be evaluated: social skills, cultural competence, teamwork, dependability, resilience. These were questions that were considered non-cognitive, in that they were they were basically trying to determine the character of the individual, if they could problem solve, if they could articulate responses. So again, it was a one-way, non-interactive type of interview. Um, I really believe that it was the pandemic that was the motivation for the AAMC to create this. Based on feedback that the AAMC received from schools and from applicants, they decided to make a transition. And the change is that the VITA will no longer be offered, and it's been replaced by a more complicated, more complex type of situational judgment test. Um, so at present, only a handful of schools have adopted it, but some of these schools, including the University of California at Davis, um, also the University of Minnesota, a number of important institutions have incorporated this into their application process. And what that tells me is that, in all likelihood, others will follow.
Mhm.
The AAMC situational judgment test, as I said, is rather complicated. There are a host of scenarios that are presented, and individuals then have to respond to those scenarios, making a determination as to whether a solution to a problem is valid, and whether it's effective. Um, Now, rather than my going into detail, and it's actually difficult to describe,
Yeah.
uh, there are some excellent tools, and I compliment the AAMC, because with the introduction of a complicated examination like this, there is a responsibility to make sure that the applicant is prepared and informed. And there are tools. If one goes to the AAMC website, there is an instruction manual, basically. There is also a practice test, and there is a discussion of the nature of the examination and the reasons why the AAMC is actually, and they state this, they actually encourage medical schools, they encourage institutions to adopt this type of test as part of their application process. So I believe it's here to stay. And one reason for this type of test, the situational judgment test, the premise is that the traditional process, which includes the metrics, the activities list, the letters of recommendation, and the secondaries, I guess you'd say the argument is that it's not comprehensive enough,
Mhm.
and it's not the best formula for identifying those people who are properly motivated and will be successful in medical school and certainly make great doctors. So that's the premise, that we need more. And I guess you could say that this goes along with a more holistic approach, because there may be, and I've had discussions with colleagues, and I've even inferred this from some of my research, where this examination, of course, it may screen out certain individuals, but on the other hand, it may actually result in a more inclusive process. Because think of it this way, people who might be borderline in terms of their metrics or maybe somewhat deficient in some areas, if they score extremely well on the situational judgment test, which again evaluates your ethics, your moral compass, your ability to problem solve, um, kind of soft qualities, I guess I'd put it that way. If you excel on that type of test, you may become a more competitive applicant, um, because if you just look at the standard criteria that we've been using for years and years and years, well, maybe this adds to the equation and could actually result in helping an individual become more competitive.
Absolutely. You make a good point. It seems overwhelming at first, another thing for another hoop for students to jump through or a hurdle for students to jump over, but it might be adding to a more holistic approach of students. Someone who might not be able to show all those core competencies through their activities could do so through this test.
Correct, exactly. And but there's an added responsibility now, and it's a responsibility to prepare. Now, it's really, really very difficult to anticipate the type of questions that they're going to throw at you. But at least you can be familiar with the format. It's apparently it's a 75-minute exam, and I believe there will be some time constraints. So time management skills, familiarity with the nature of the questions, and the manner in which you're supposed to respond. Simply practice.
Mhm.
And again, fortunately, there's a very nice sample exam which applicants can take advantage of. And I also believe, of course, that there will be counseling services, including MedSchoolCoach, that will react to this and provide services, provide a product, because what's the goal of organizations like MedSchoolCoach? It's to um, make sure that worthy individuals present themselves in the best possible way so that they can gain acceptance to medical school. That's the goal, right? And
Right.
so part of that responsibility, I think, is to respond to the introduction of these situational judgment tests. And I know these various services will respond to that.
Absolutely. So I just have a couple of questions about the SJT.
Sure.
The first of which being, how does this compare to the CASPER? Are they doing the same things, and will students be in a position where they have to take both?
Well, that's a great question. It's one that I don't think has been really fleshed out yet by the individual institutions. I see great similarities in terms of the goal of the examination. They are both SJTs. Um, what's very different, though, is the format of the exam. the CASPER is, the multiple scenarios, of course, but there is a response that's typed right now.
Hmm.
Um, there is a time limit. You're given a scenario. It can either be video or word. With the Casper, I believe currently there are, I believe, 8 video and 4 worded scenarios. The individual then has to respond to that scenario by answering 3 questions. And I believe you have 5 minutes to answer the 3 questions. It's typed, and then you move on. This is different. The AAMC exam presents you with numerous scenarios, and then there are um, follow up questions and scenarios based on that, and the individual then has to make selections as to which responses are most appropriate, which responses might be most effective. So even though I think the endpoint is similar, I
Hmm.
think the purpose is similar. Uh, they approach it differently, certainly from a technical standpoint. Um, I think they are somewhat competitive. Whether schools will choose one or the other, possibly even both, I don't know, quite honestly, because I can tell you that the situational judgment test by the AAMC, it's brand new.
Hmm.
And like I said, only a handful of schools are actually utilizing it right now, but I think we're seeing the future. As for Casper, that's been around for a while.
Right.
I know that when I began my advising career back in, I think, 2014, there were only a handful of schools. It was very similar to what we're going through now. There were only a handful of schools that were using it for pre-screening. We were kind of scratching our heads because we really didn't know exactly how it would be used. Would it be used as a substitute for the conventional interview? Would it be an addition? Would it be complementary? And more schools began to adopt the CASPER as a pre-screening tool or a screening tool rather than a substitute for the conventional interview. It became almost an adjunct to the application. And we're at a point right now where I'd say close to 50%, certainly of the allopathic schools, are utilizing the CASPER.
Hmm.
Now, whether there's going to be a change in that dynamic as we move forward, I honestly don't know. And I'll be closely monitoring the situation.
Okay. I got a chance to peek at the practice
You
exam that
did.
they offer. Yeah, you're right. It's hard to sort of explain fully. The best chance you'll get at understanding it is taking a look at that practice test. But I noticed they offered examples and then answers at the end, just so you
Correct.
can see how you're measuring up. And compared to the Casper exam, which has a bit more nuance and wiggle room in terms of your responses, the SJT is right or wrong
I know.
on that scale. Is that to our advantage, to our detriment?
Well, actually, for each question and each response, wasn't so much right or wrong. It's that there's not good, there's
Yeah.
better, there's best. That's the
Yeah.
best way to describe it. And it's almost as if you're building up points. The more closely that you match their
Okay.
best response, you build up points. But the way it's going to be graded, same thing with the Casper. It's a bit of a mystery. There's
Okay.
not a lot of transparency here, and how the schools are going to use it is a little bit unclear. But we may get to the point that for many of these institutions, it's going to be compulsory. So you
Mhm.
just have to sort of grit your teeth and prepare. And there are literally hundreds of potential responses on this exam. There are so many
Yeah.
different permutations. If you took the practice exam or if you looked at sample questions, I'm sure that's something that struck you.
Yeah.
Um, so but I guess the best way to put it is the institution makes the rules
Mhm.
and we have to comply. And whether we like these changes or not, or whether we're comfortable with them or not, doesn't matter. We have to respond.
Mhm.
And so I think that as we move forward, I think preparation for the AAMC SJT is going to be um, crucial. It's going to
Right.
be crucial. Um, we know that medical school, applying to medical school is incredibly competitive. About 40% of applicants gain admission each cycle. And I can tell you from seeing many, many applications that a great deal of many, many worthy individuals um, do not gain acceptance because to some extent it's a numbers game. And with the heightened competition, and I see this year after year, more difficult and more difficult, um, what I think schools are doing is they're saying we need more information on applicants uh, to be able to distinguish between those who they believe are going to be successful and are entering the career for the right reason, and individuals that maybe they have some doubts about. Um, with the traditional application that really hasn't changed in many, many years, it can be very difficult to distinguish between all these highly accomplished individuals. And I guess what the schools are saying is we need more differentiators. We need something else. And again, I think they're pushing away, maybe a little bit away from the metrics,
Mhm.
from the cut and dry, and
Yeah.
they're looking a little bit more. Look, if you look at many of the publications, if you go to the school websites, if you read their brochures, they talk about we're holistic. We look at the whole person. And of course, that's difficult to do. Maybe this is an attempt to really follow through with with what they're saying on their websites, what's in their mission statement. So maybe they're gravitating towards this because they want to evaluate some of the qualities that you just may not get a feel for when you just look at the standard AMCAS application, uh, which is at the heart of all this.
Okay. Yeah, I totally agree. I think this is, again, like I mentioned earlier, it's another hurdle, but I think it might be a necessary one and help out a lot of students. My last question is in regards to the length and thickness of this test. 75 minutes, which is nothing compared to the MCAT, but it's pretty text heavy. I mean, there's no typing, just a lot of reading and a lot of clicking. Are you
Right.
aware of any breaks that students might be able to take throughout this, or is it just one time through from start to finish?
I saw no evidence of a break. I mean, I went through the literature um, that just came out, and I'm going to go back and take another look.
Okay.
And I agree with you. I know with the Casper they do allow a 10-minute break partway
Right.
through the examination. With this examination, I don't recall seeing any reference to that. That doesn't mean that one won't be introduced or it doesn't exist, but I don't recall seeing that. And you're right. It's a marathon. It could be
Mhm.
somewhat grueling, I would think. Um, but it's just another hoop to jump through. It's another hurdle to negotiate. And the fact is, um, I believe individuals though can give themselves an edge by at least familiarizing themselves with the types of questions that are asked and the technical aspects of the examination, again, which includes it's almost like a scenario and then a multiple choice
Right.
type of response, which is actually something different. It's something fairly. Um, it's certainly in contrast to the other situational judgment tests like the Casper.
Mhm. And it's free as of right now. Is that true?
As of right now,
Right.
it is free. I'm not surprised about that.
Mhm.
I think they want to encourage acceptance. I mean,
Mhm.
there are reasons for this. They're probably also they'll want to gain feedback as much as they can get.
Hmm.
So, whether it'll remain free during additional cycles, I don't know. But I'm not surprised that it was introduced as a free component. I don't think they want to do um, introduce any financial hurdles for individuals.
Right.
They want people to take it. They want to get the feedback, both from institutions and applicants. So, whenever you introduce something new like this, it makes all the sense in the world to try to make sure that as many applicants and as many institutions take advantage of this. So that, and it probably to some extent will be a work in progress over the next few cycles.
Okay. Well, thank you so much. A
Sure.
beautiful overview of the SJT, and next steps are just to get in there and start looking at those sample tests.
Exactly, exactly. Best of luck to all. And I know that applying to medical school is becoming an increasingly rigorous process,
Absolutely.
but prepare and be up for the challenge.